Hello, I'm Bernadette Lavery. I'm a clinical oncologist and I'm here to talk to you if you've been diagnosed with breast cancer. I'll tell you about breast cancer and different types of treatment you might have. When people talk about breast cancer, they usually mean invasive breast cancer. This is when breast cancer cells start in milk ducts or lobes and have spread outside into surrounding breast tissue. Breast cancer can affect men as well as women. Ductal carcinoma in situ, DCIS, is a type of non-invasive breast cancer. It's the earliest form of breast cancer, where the cancer cells are completely contained in the ducts and lobes and have not spread into surrounding breast tissue. You can find more information on breast cancer in women, DCIS, and breast cancer in men on our website. The risk of breast cancer increases as we get older. In women, some risk factors are linked to your hormones, like when you started periods or if you've had children. For both men and women, having a family history of breast cancer is also a risk factor. Your doctor will explain the different treatments and their side effects to help you decide what's right for you. Surgery is usually the first treatment for breast cancer. A surgeon will remove the area that has cancer and may also remove some lymph nodes in the armpit. Women may also choose to have breast reconstruction. This is an operation to make a new breast shape. Radiotherapy uses high-energy rays to destroy cancer cells. It's usually given after surgery to the area where the cancer was, and sometimes to the armpit. This is to reduce the risk of cancer coming back. Chemotherapy uses anti-cancer drugs to destroy cancer cells. You may have chemotherapy after surgery to reduce the risk of the cancer coming back. Chemotherapy may also be given before surgery. This can shrink cancer to make it easier to remove with surgery, or it might be given if the breast cancer is growing more quickly. Chemotherapy is only used to treat invasive breast cancer. Estrogen is a hormone made in our body that can encourage some breast cancers to grow. Hormonal therapies reduce the amount of estrogen in your body or stop it attaching to receptors on cancer cells. These therapies only work for people whose breast cancer has receptors for estrogen. If you have invasive breast cancer, your cancer doctor will usually advise that you have hormonal therapy for a few years. Targeted therapies are used in breast cancer where the cells produce a large amount of a protein called HER2. The extra HER2 protein encourages the cancer cells to grow. Targeted therapy drugs latch onto HER2 and stop the cancer cells growing. You may have targeted therapies on their own or with chemotherapy. If you have further questions about your stage or treatment, contact your cancer doctor or specialist nurse.
We're here to help everyone with cancer live life as fully as they can, providing physical, financial and emotional support. So whatever cancer throws your way, we're right there with you. For information, support or just someone to talk to, call 0808 808 0000.